Up for and not simply ascribe it to MS without pursuing it further.
Seizures?
So seizures are uncommon in the general population and uncommon in MS, but slightly more common in MS than in the general population. I think that seizures happen only a couple of times out of 100 in multiple sclerosis. So the vast majority of people with MS live their lives seizure-free. Seizures themselves take many forms, from the generalized convulsions that we think of when we think of seizures, to much more subtle and mild events that are still seizure in nature. Because MS is a disease that affects the brain, lesions can potentially irritate parts of the brain and give rise to seizures. And seizures in MS are treated just like seizures without MS with anticonvulsant medications, which can do a wonderful job at getting people to be seizure-free or nearly seizure-free.
And breathing problems?
So breathing problems are very unusual in MS, especially in relapsing remitting or early multiple sclerosis. But like trouble with speaking, dysarthria, or trouble with swallowing, dysphagia, breathing problems can occur in advanced and serious cases of MS, where the muscles that are involved in breathing and respiration, like the muscles that are involved in speaking and swallowing, can be affected. But it's quite unusual. An MS sensory symptom, the MS hug, where patients describe a squeezing, constricting feeling, can sometimes occur around the chest and thorax. And in those situations, patients may feel that they have difficulty getting a deep breath because they feel a tight squeezing feeling. But I think of this as more of a sensory phenomenon in multiple sclerosis rather than a true difficulty with breathing and respiration.
Can you talk a little bit about why there are so many symptoms and all these different ones, some common, some not, and whether there's any way of knowing the frequency of how these symptoms happen?
Well, MS is an incredibly varied disease, and as everyone who's watching this knows, no two patients with MS have exactly the same story. That can make it frustrating in a sense, because it's hard to know for a given patient what to expect or what their MS is going to be like. And it makes it challenging for the neurologists and for the physicians to know what is being caused by MS and what isn't. So the common symptoms are common, and those are ones that we all recognize are likely due to MS. But I think it's important for physicians to be aware of and vigilant about making sure that if someone presents with an uncommon symptom, that it gets properly pursued, that it's not just written off as being part of multiple sclerosis. I often tell healthcare professionals, as we get better and better at taking care of people with MS, they are going to live longer and more normal lives, and therefore they're going to come down with things that affect everybody else. And we have to be careful not to just say, it's your MS. So that's something that I think is important. It's important that patients talk to their doctors about the symptoms that they're experiencing and work with them to get to the bottom of them.
Well, that's what I was going to say. On the flip side, if a patient is having a symptom that could be MS or could not be MS, how do they know that it's MS related?
Well, I think that although we like to partner with our patients and work with them in a collaborative way, I think the burden of figuring out what is MS and what isn't MS shouldn't be on the shoulders of the patient. I think that needs to be on the shoulders of their doctors. I think what the patients need to know is that they ought to feel very free to talk to their physicians and their neurologists and their nurse practitioners about the symptoms that they're having, to give them the information they need to figure it out. It can sometimes be quite challenging. But I think that if a patient is experiencing something that seems unusual or different, particularly if it lasts for more than a day, they should call up somebody who's taking care of them and discuss it and see if it gets up their concern. But figuring out what is MS related and what's not MS related is a bit of a challenge. Thankfully, we have both the ability to examine patients and look at them neurologically and see if the symptom is causing something that we can recognize. And also workups, including diagnostic imaging like MRIs. And MRIs, although not perfect, can often show us if there are changes that MS is causing that are giving rise to particular symptoms. And so frequently, if someone's experiencing a new symptom, they may merit getting a new MRI to see if the MS is causing it.
Dr. Krieger, thank you so much.
My pleasure.
If you would like to get more information on symptoms of MS, go to nationalmssociety.org. This is Kate Milliken for MS Learn Online. Thank you for joining us.